we got a lot to cover. And why don't we start off right there? In your mind, from your perspective, what do you think some of the most remarkable thing that happened in the last decade, and when talking about melanomas?
Yeah, so the last decade is really a good time frame because it's now 2023, and I believe the first FDA approvals for some new therapies may have happened around 2013. I remember I was at the annual meeting for the American Society of Clinical Oncology in 2011 when the results of ipilimumab, which was the first immunotherapy, were released, and even though the results were not spectacular, they were the first positive signs of a new therapy for decades in melanoma, that something was working, even if it was just a small increase. So, and that really led the way for the advances in immunotherapy, which have been spectacular. Melanoma has really led the way in all cancers in the development of immunotherapy because it is such an immune responsive tumor in many cases. But really, the really spectacular change in melanoma is that not only as immunotherapy became more effective with new agents and combination treatments that have really cured many people and have improved the 5-year survival tremendously. I like to tell people when I first started, if people with metastatic melanoma, maybe 5% of them were still alive 5 years after the diagnosis. Now, probably 30 to 40%, are still alive after 5 years, which means many people really have been cured. So this has been really spectacular. But it's not only immunotherapy; there's targeted therapy.
Yeah.
So around that time, the BRAF mutation was, which is like a stuck gas pedal for cells, right? That's what I always like to refer to. A cell is like a cancer cell, is like a car. It's lost its brakes and it's got a stuck gas pedal, so it's going out of control. So these targeted therapies, these small molecules, they basically unstick the gas pedal, which is the mutated protein, and in this case it's called BRAF, and that basically shuts down the cells, and many cells die. The BRAF targeted therapy, and then in combination with a second agent, the MEK therapy, anti-MEK therapy, really produced also very dramatic improvements in survival, and really spectacular images of patients who were riddled with metastatic disease, in short order could see those disease disappear. Now, of course, the problem is that cells become resistant to these kinds of therapies, and you have to have the mutation that it gets targeted. So, but the good news is about half of melanoma patients with metastases have that mutation, so they are eligible for the targeted therapy. So when you look at the effects of the two together, you see this huge decrease in death from melanoma. And we actually published a paper that came out in 2020, and unfortunately, it came out the week that the United States shut down due to COVID. But there's this very dramatic drop we showed by looking at population-based data. So not only these clinical trials produced these results, but it actually got out to the population and was, because of FDA approvals, and was being used. And we see this spectacular drop of about 18% decrease in mortality over just about 3 years, from about 2013 to 2016, I think was our data set. I can't remember, maybe a little bit beyond that, but we mapped it with the FDA approvals of these immunotherapies and these targeted therapies. And so there's less people dying from melanoma now than there were in the 1980s, even though the caseload of melanoma has increased. So that's been really, really spectacular. It's
No,
it's the greatest accomplishment in all of cancer, and there's no other cancer that has seen such an improvement in the treatment of metastatic disease and reduction in deaths like this.
yeah, I mean, I think especially the immunotherapy, its efficacy on metastatic melanoma really paved the way for this modality to treat a whole bunch of other type of cancers.
Right, exactly. It's effective in lung cancer, renal cell, others. Yeah.
Yeah.